host, Brittany Maxwell. For this episode, we are going to be covering some of the most common memory loss symptoms and how to differentiate them from dementia. Today, we have Dr. Sadiq here with us to give her advice on the topic. Thank you for joining us here today, Dr. Sadiq.
Thank you for having me, Brittany.
Well, as always, we're so happy to have you. So, Dr. Sadiq, I heard that you specialize in Alzheimer's and other memory loss diseases. Is that true?
Yes, I'm an internal medicine doctor, but I did fellowship in geriatrics, which actually helped me out and understand this disease better.
Well, then you're perfect for today's episode. It's such a perfect topic for us to cover. I feel like we should actually have a couple more episodes on this topic. Don't you agree?
Yes, I agree, as a lot of people don't understand what the memory loss is or dementia.
That's so true. I believe you prepared for us some of the most basic knowledge about dementia and how to differentiate them from general forgetfulness.
Actually, today I'm just going to briefly introduce what is dementia and how to self-diagnose your symptoms.
Well, that sounds like a plan to me.
Yes.
So what is dementia?
Actually, dementia is a brain disorder that makes it hard to remember, think clearly, make decisions, and even control your emotions.
And what is Alzheimer's then?
Actually, Alzheimer's is the most common type of dementia. 60 to 80% of the people who have dementia have Alzheimer's. And it actually is a very progressive condition, which means it gets worse over time, and it usually affects people over age 65. And unfortunately, there is no cure for it, but any age it can happen.
That's so sad, though, that there's no cure. With that being said, how does Alzheimer's occur then?
It happens when the protein, which we call plaques in your brain, and fibers, which are known as tangles, build up in your brain and block nerve signals and destroy nerve cells. Memory loss may be mild at the beginning, but if these plaques and fibers, the tangling occur more and more, then dementia get more progressive, more worse with time. And at time it is very difficult to even carry on the conversation or do simple tasks in everyday life. People get more confused, more aggressive, mood changes, and these are some of the most common symptoms of dementia. And the final stage is very sad, when people forget to even chew the food. They forget when to go to the bathroom. That is very worrisome, and that is like a very sad, even for the family, to see the loved one that way. What happens is the brain is not sending the signals, because brain is all mushed up with those tangles and proteins and plaques, so there is no signal going and telling the patient drink the water or chew the food. That is why it is so important to diagnose this disease at an early age. If we diagnose at an early age, we can still slow the progression of the disease with these medications. Seek for the help at an early age.
I totally agree. I've personally witnessed this with a few relatives of mine, and it's not pretty.
It's sad.
And I've heard that memory impairment is not just a problem for the elderly anymore. Sometimes I feel like I'm getting forgetful about everyday things too, and start to worry about getting Alzheimer's.
No, don't worry about that. There are two types of memory impairment. One is benign forgetfulness, and the other is malignant memory loss. Benign forgetfulness can happen to anyone at any age, but the majority of the people are over age 65. It is not serious. It is annoying, but not serious. Benign forgetfulness is normal and can happen to anyone. Just as forgetting where your car keys are or where you parked your car, like my husband does it all the time.
I do too.
It's common,
yes,
but it's not worrisome. On the other hand, malignant memory loss can be a sign of dementia. It is crucial to know the difference, because if you discover dementia at an early age, you can actually slow down the progression, and you can take the medication which can help to slow down the disease process.
Right. Well, with that being said, how can we determine the difference between dementia and benign forgetfulness?
Actually, there are 4 ways to self-diagnose your symptoms. First, simple short-term memory loss. That's a very, very important point. If you cannot recall what you ate an hour ago or which TV program you saw an hour ago, that's a problem.
What's our second sign then we should watch out for?
Second is illogical forgetfulness. If you're actually forgetting your cell phone in the car or in the taxi, that's all right. But if you find your cell phone in a freezer, that is worrisome. Illogical forgetfulness. And the second is example for this is like if you forget your coat in your office, that's all right. But if you're not wearing coat in a weather snowing outside and you are without coat, that is worrisome.
Not to mention you'll be freezing.
Yes.
So what's the third sign then?
And the third sign is when you set up appointment yourself with a friend or family or any event and you actually forget, even when your friend is calling you, you have an appointment today, and on reminder, you still cannot remember your own events which you actually scheduled. That's a problem.
And what is the last sign then?
Actually, the last sign is that if someone does not know what the problem is, if your people around you, your loved one, is bringing you to your attention and or bringing to the doctor that patient is losing the memory, that is a very worrisome. Family members or the loved one around the patient, please seek the doctor's advice. It is very, very important to take the patient to the doctor, as there are very simple tests available which we call mini mental that can be done in 5 minutes or 10 minutes, and we can get some good answers.
And with that test being said, are there any other recommendations that you could give to family members to help prevent dementia?
Eat healthy, that's the most important thing. Walking in the sunlight, that's very, very important, because sunlight helps maintain the hippocampus in your brain, which plays a very, very important role in consolidation of information from short-term to the long-term bucket. So
Right.
it's very, very important.
Plus it feels good on your skin.
Absolutely. And also the bones.
Yes.
And the next is be happy. Mood is very important. Next is brain exercises. It's very important to keep your brain engaged.
Right.
Crossword puzzles or any activities which you like. And next is be productive. Keep doing what you were doing like all your life. That is going to keep you young and healthy and happy. The food part is very, very important. Some of the foods have a lot of antioxidant. So almonds has a lot of antioxidant, berries. And next is avoid synthetic food and artificial food.
Well, speaking of synthetic and artificial foods, is there any specific ones that we should keep away from?
Actually, I would advise not to use a lot of microwave popcorns and sweeteners, and also stay away from microwave.
So rather cook it, don't nuke it.
Yes, be healthy.
All right. Well, I feel like this has all been so informative, Dr. Sadiq. I feel our audience has gotten a lot of knowledge from this episode. Thank you again for being here with us today.
Thank you.
Until next time, viewers, stay healthy, happy, and live better.